Electrolyte imbalances can happen and be symptomatic even though the laboratory values are normal. This is Dr. Lam, founder of drlam.com. Why do we say that? And the reason is because in advanced stages of adrenal fatigue, you will find that there will be sufferers that comes in with normal electrolytes level, but they can be sodium depleted. They feel better when they are taking more sodium, for example. They don't do well, for example, with taking potassium, such as eating a banana. And some of them cannot tolerate food that is high in potassium as well. So we know subclinically that there's an electrolyte imbalance that's going on. However, the laboratory test invariably will be normal. So what is really going on? We suspect that in the case of adrenal fatigue, especially with sodium, the aldosterone, which is the hormone that regulates sodium in the body, can be compromised because aldosterone is made in the adrenal glands, and when the adrenals are in a fatigue state, the aldosterone level can be reduced. When aldosterone is reduced, then the sodium retention is reduced and the body tends to lose sodium and water, and as a result, the person tends to be dehydrated and want to drink a lot of water. When the sodium goes down, the opposing mineral called potassium will go up, and therefore the body will sometimes have tachycardia as well as cardiac arrhythmias as well. However, the interesting thing, as I said earlier, is that the laboratory continues to be normal. So just because the laboratory level is normal does not mean that one does not have electrolyte imbalances subclinically. Now, recognizing this is very important because this will solve a lot of the complaints that people have with adrenal fatigue when they get to advanced stages. Now, it does not mean that you do not do a full workup, and normally the family doctor or the hospital would do it because commonly people will present themselves in the emergency room dehydrated and then have electrolytes and IV bags and told to go home, and then after an extensive workup. But they will repeatedly go to the emergency room because they continue to have electrolyte imbalances. A little bit of salt can overwhelm them. A little bit of potassium can also overwhelm them. It seems that the body is such a fragile state, that they cannot tolerate a small movement in sodium and potassium balance especially. Now, normally, people that are healthy can tolerate and adjust the sodium and potassium level within a range within the blood. In the case of adrenal fatigue, the range is still within normal, but inside the movement itself, even though small, can cause a lot of symptoms, and that is what is commonly seen in adrenal fatigue. We don't have a real good reasons for this now, but we do know that it is related somehow to the neurotransmitters as well as the sympathetic nervous system, in addition to the electrolyte imbalances itself that can trigger a lot of collateral damage along the way. So do not be surprised if a person comes in complaining of sensitive to electrolytes, either easily too much or too little, but their laboratory is normal. I hope you've enjoyed this video. For more information on this topic, head over to drlam.com, where I have written over 1,000 articles to help educate people. You can also call me at 626-571-1234 for more information on adrenal fatigue and how to navigate it. Finally, if you enjoyed this video, please subscribe to my YouTube channel. Thanks for watching.